The aim of this video is to try and highlight for you what you can expect through the process of sexual function recovery after you have a radical prostatectomy. Hi, my name is Dr. Charles Chabert. I'm a urologist, director of the Prostate Clinic, and I've had the privilege of guiding men through their prostate cancer journey for the better part of the last couple of decades. In today's video, we wanted to hone in on what a man can expect following surgery for his prostate cancer, and really what options are available for that man and his partner to try and guide that man through this challenging time. Please, if you get value from the video, consider subscribing and giving it a thumbs up. It makes a big difference for the YouTube algorithm. Okay, let's get into it. So if we take a backward step, the prostate really is part of the male reproductive system. I saw a poll recently that quizzed men on whether or not they had any insight really as to what the prostate did. And the majority of men really, they may have some idea about prostate cancer and remotely that the prostate is actually in the pelvis, but the majority of men have got no real idea. So to answer that question, it is actually part of the male reproductive system. It sits deep within the pelvis. It's located between the pelvic floor and the base of the bladder, and it's just in front of the bowel. Its role is to produce fluid, and that fluid really is nutritional support for semen. So the majority of fluid that a man sees when he ejaculates actually comes from the prostate and two little structures that are attached onto the back of the prostate called the seminal vesicles. They're actually a reservoir, if you like, for prostatic fluid. So the prostate's an integral part of the male reproductive system. It produces this fluid. But more importantly than that, associated with the backside of the prostate are erection nerves, is the best way to think about them. There's one on the right, there's one on the left, and really they're plastered on the backside of the prostate. Having intact nerves and intact nerve function is critical for a man to be able to have an erection. When we look at sex life in general, or sexual function in general, it really comes down to two main categories. One is erections and the other one is ejaculation. And I wanted to really highlight the impact that prostate cancer surgery or a radical prostatectomy can have on both of these. So let's start with erectile dysfunction. Erectile dysfunction basically is the inability to have or maintain an erection sufficient for penetrative intercourse. There are a variety of different causes for erectile dysfunction, and it can happen even if men don't have surgery. Crudely speaking, the older a man is, the more common it is to have erectile dysfunction. And the risk factors for developing this: advancing years, smoking, diabetes. Men carry excess weight, they can have high cholesterol, they can have high blood pressure, and certain medications can contribute to it as well. But from a surgical perspective, when men have a radical prostatectomy, in essence what we're trying to do with that operation is to remove the whole prostate together with the seminal vesicles. So we're moving that male reproductive gland. And when we do that, we're trying to do that in such a way that is a balance between ensuring that we remove someone's cancer, but minimizing, if you like, collateral damage, minimizing trauma to the structures that are immediately surrounding the prostate. And two of those structures really are those erection nerves, and below the prostate, we've got the pelvic floor. And it's those key structures that really give you an idea of why following surgery, or even radiotherapy, but following surgery, we can have issues with sexual function and also urinary incontinence. Depending on someone's disease profile, basically by that I mean, how big is someone's cancer? Is it more aggressive? And is that cancer in the area of where one of these nerves are? If it is, it impacts our ability to be able to spare those nerves. Erections, as we can see, can take a hit, if you like, following a radical prostatectomy. The other thing that happens to every man is changes in ejaculation. So part of the quality, the sensation, the feeling, the enjoyment that a man gets during the process of an orgasm is the process of actually emitting fluid. And as I said, that fluid that a man ejaculates, the majority of it comes from the prostate. So we remove the prostate, we remove that ability to emit any fluid. So every man after surgery has a dry orgasm that's permanent. And that can change the quality, that can change the enjoyment. So some men say to me, it feels just the same, but there's no mess. Some men say it's less intense, it's a little bit shorter. Some men actually say to me that they don't know what I did down there following the surgery, but it feels more intense. Now, the take home from that description basically is that there's a variety of different things that men can experience with a dry ejaculation. It's very individual. There's no way that we can predict who is going to feel what. But it's really important for you when you're making your decisions about certain treatments to go into that decision with your eyes open and expect things to be different. From a sexual function point of view, another thing that men can experience following a radical prostatectomy is loss of penile length. Now, before surgery, if men are having erections, there is regular blood flow to the penis. And the simplest way to think about this is that when there's regular blood flow in and out of the penis, when there are regular erections, I should say at this point that the majority of men, if they have no erectile problems prior to surgery, men will experience anywhere between 3 to 5 spontaneous erections per night whilst they're asleep. In essence, that keeps the penile tissue healthy. Following surgery, men no longer have those nocturnal erections. And if we don't recover things and encourage blood flow to the penis at an early stage, the analogy is that the penile tissue is a bit like a sponge. And if there's no blood flow, if there's no erections, that tissue can dry up and there can be penile shortening. And so a proportion of men will report following surgery. Some say to me, Charles, did you cut a length of the pipe away and shorten my penis? And I explain to them some of the pathophysiology, the mechanism behind why they can experience some penile shortening following their surgery. I mentioned earlier that urinary incontinence is also a functional issue that can happen with surgery. And in fact, the majority of men do go through a period where they will experience urinary incontinence, but with dedicated pelvic floor physiotherapy, this tends to recover with time. In men who recover their urinary control faster than others, so within a matter of weeks, sometimes a month or two, those men, if they are also sexually active earlier on, can experience the ejaculation of urine. And so what happens is that they have the sensation of an orgasm, and if they have urine in their bladder, they can have relaxation of the muscular control of the bladder that can result in some emission of urine during the process of ejaculation. That's called climacturia. Okay. So those are the key 4 aspects that we can see following surgery. To summarize, changes in erections, changes in ejaculation, changes in penile length, and on occasions, ejaculation of urine or climacturia. Now, what can we do for all of this? Well, there are 3 key mechanisms that we have for the recovery of erectile function. The probability of recovery is dependent on a variety of different factors. To begin with, it's dependent upon how good someone's erections are before they start, and do they have other risk factors for erections not being as good as they used to be. Do they carry too much weight? Do they smoke? Are they diabetic? Is their cholesterol high? How's their blood pressure? In addition to that, how old is that man when he comes to surgery? The more boxes we tick, basically, the lower the probability of recovery. Let's assume someone has good erections beforehand, they're a younger man, i.e. less than 65, and their disease profile is amenable to a bilateral nerve-sparing approach, then in those men, they have a higher probability of recovery, and we will be more aggressive with their rehabilitation. When we spare those nerves, it's important to be aware that those nerves still, they don't work properly to begin with. The technical term is that they have a neuropraxia, and it takes time, and it can take 12 to 18 months for those erection nerves to fire properly and for things to recover. During that time frame, we have medications. Those medications are what we call phosphodiesterase type 5 inhibitors, things like Viagra or Cialis, and they're the 2 brands that we tend to use here in Australia. The generic for those are called sildenafil, which is Viagra, or tadalafil, which is Cialis. Men take them prophylactically after their surgery. The misconception when men take these drugs is that they take a tablet and they're going to have an erection afterwards. That's rare. What we're looking for in the post-operative period really is increased blood supply to try and keep the penile tissue healthy to facilitate a better recovery than if we do nothing. In addition to tablets, the other option is injections, and they're penile injections. Now, I lose many men when I make reference to this because it does involve you or your partner injecting the base of the penis with a stronger medicine. Now, the pro to doing this is that the probability of having a meaningful erection that facilitates penetrative intercourse in the shorter term is greater, and it also does help recovery in the longer term. So if men can get over that psychological hurdle, if you like, of injecting their penile base with a needle, it's a better option moving forward. We've got vacuum pumps, which can, if you like, draw deoxygenated blood, so blood that's got no oxygen in it, into the penis, and that can facilitate rigidity in the penis that can allow sexual function. It's important to note, however, that vacuum devices bring in blood with no oxygen rather than blood with oxygen. So if people have the tablets or the injections, we get more oxygenated blood, and that's really what we're after. That keeps the tissues healthy. If a man doesn't recover as we would hope, or if he has had a non-nerve sparing approach, or if his erectile function was poor previously and he wishes to have regained sexual function, the next option is surgery, and that would be in the form of a penile implant, which inserts a controllable device that allows a man to have a rigid penis to facilitate intercourse. The scope of that is beyond this discussion today. The other thing really is to instill in men the importance of doing pelvic floor physiotherapy, and I encourage all my patients to go and see our physiotherapist before their surgery, to go and touch base after surgery. And in my experience, when men are committed with a dedicated physiotherapist who has specific training in this area, the outcomes are far better. Men understand the nature of what they're supposed to do with the pelvic floor exercises, and they have personal buy-in and tend to be more diligent and more committed. So to summarize, as you can see, there are a variety of different factors that can affect a man's sexual function following surgery. It takes time to recover. Part of the key is to be adaptive, to be patient, to discuss these practicalities with your partner, and to be open to different ways of trying to rehabilitate the situation so that you can have a sex life that you and your partner are happy with moving forward. I hope this video was of benefit. Please, if you've got comments, if you'd like to share your journey, leave your story, ask questions in the comments section down below. It really makes a big difference for other men that are going through this journey to know that they're not alone and that there are others out there who have experience and have been through this pathway and are happy to share their experience with others. Until the next video,